Okay, so today we are, first and foremost, let me just introduce myself. My name is Latrice Bennett, and I'm on with Becky Cacalise, and we're going to be talking about depression. Now, this is one of our pre-recorded classes, so we don't break down a whole lot. We just break down the what, when, and why factors of depression. And our job for Same Face, Different Emotion is to make others aware so that they understand. We can listen to them, they can listen to us, then we can learn from others, and then we can also relate to their situations and teach them, and they can go out and educate others, as well as educate ourselves so that we can be better for not just others, but better for those who are struggling on a regular basis. So, depression. So, when we get into this topic, basically, we're not going to, we don't get too deep into it. We're just going to break down some factors of it, and also knowing when to recognize it, knowing when people need help, knowing when psychiatrist needs to come in, and also uh, the fact to understand when it's all starting, where it started at, things of that nature. So let's just get to the bottom of it. I'm just going to close my window. I think I hear someone mowing their lawn. Okay, so depression. So let's just talk about it. So what is depression? Because if I'm not mistaken, Beck, there are four different types of depressions, psychological factors, right?
Yeah, so there's persistent depression, there's major depressive disorder, there's regular seasonal depression, there's adjustment disorder with depressive episodes. So there are definitely various kinds of depression that people can deal with.
Okay. So I know from psychiatry.org, basically they're defining depression as a common and serious medical illness that negatively affects how you feel. So we know with depression, a lot of things can affect how we feel, but I think it's when we start to it really internalize that, when it turns into the depression, if I'm not mistaken, because I know that you can lose someone, you can have feelings of sadness, but we shouldn't mistake depression for grief either, if that makes any sense. Because
Right.
they're different things, but you can be depressed while you're grieving. Am I correct?
Yeah, so depression is definitely one of the stages of grief. It's what we look for as therapists when the grief starts lasting longer than what is perceived as, the expected amount of time that someone would grieve a loss. Then we start worrying that someone's going to start developing like major depressive disorder. But it definitely, people based on their environment, based on genetics, those types of factors all lead into whether they develop depression.
Okay. So I have one other question. I know that depression ties into a whole lot of other things as well. And that's why we try to break down low self-esteem, those factors, also, the grieving factors, also the low self-talk and shame and guilt. All of these things are actually intertwined and interconnected with one another, because it can also cause you to be depressed. So I think that when we start to really get that concept, then that will help us along the way, because we think that, oh, because we're sometimes I just have these feelings of sadness, and then it turns into something else, and I could be grieving, and then I could be turning around feeling some type of way about something that I might have went through 10 years ago. So all of those things are a major factor, and that is something that I think we really need to address and take into context, because there are things that we don't like to look at and see that, you know, if your change, your mood, and all of these things are so different, and it has something to do with something that you've been through before in your life, then now you can start to try to figure out what it is. Now let's get to the bottom of like recognizing it. So okay, so symptoms and stuff. So they could be severe and they could be mild.
Yeah.
The sad, feeling sad, having that depressed mood, loss of interest is a big one.
Mm-hmm.
Because not really wanting to do the things that you used to do. And it doesn't necessarily mean that just because you're losing that interest means that, oh, I'm just so depressed, because your friendships with people could have changed. You could be changing mentally and emotionally. That can play a major role as well. And it doesn't necessarily mean that you're depressed. It just means that you're growing you're growing into a different individual. So also that's what I wanted to get at too, because I know, do people get diagnosed sometimes when they do lose interest and pleasure in things and activities of that nature? Is that like sometimes can it be a misdiagnosis because of their growth somewhere else, maybe spiritually, mentally, and emotionally?
It's possible. I mean, it can definitely happen. I think that's why therapists and psychiatrists kind of use caution when using a depressive diagnosis on, you know, especially like an adolescent, because we're trying to figure out, you know, are they just, like you said, growing in a different way? And that's why they're experiencing some of these changes, or is it true depression? It's also important that, you know, on the DSM, there are certain criteria that, you know, have to meet in order to be diagnosed with depression. So it's important that, you know, loss of interest is a big one, but there are also, you know, many other factors that they have to meet in order to be diagnosed with depression. So if they don't meet those factors, if they have loss of interest, you know, or loss of pleasure in an activity that they used to, you know, engage in, that's why, you know, that's looked at and try to be examined as to what is going on in that specific situation. Okay. Instead of just saying right away, like, oh, it's automatically depression.
Yes. Changes in appetite.
That's a big one. That could be, you know, they're getting older, so their appetite just changes. I mean, some people don't eat as much as, you know, they did when they were younger. Some people eat more. It just depends. But that is a pretty big one, because, you know, overeating or undereating is a sign that something is going on, you know, and it can lead to an eating disorder. So you want to kind of examine that and try to get a hold of it before and if it turns into some sort of eating disorder down the line.
Okay. Most definitely. Increased fatigue. I think that's a big one. Only because you're more tired than what you've probably been. Now that could be a possible factor of just needing some more vitamins in your body and or some more nutrients. But fatigue, when you're always tired, I think that is another thing that, you know, we have to look out for sometimes when you're depressed and stuff of that nature. So
yeah. And it could be like just, you know, trying to get motivated. Like you feel tired, like you can't, it's hard to, it feels like a chore to even like get a shower and wash your hair. Like that feels like a chore. So that could definitely be a sign of depression.
Or not wanting to wash anymore. That also.
Yes, hygiene's a big one. You know, if someone's goes, you know, a week without getting a shower or washing their face, you know, then it definitely is a sign that something is going on. That's usually a big hint that something is happening.
Now, the feeling of worthless and or guilty, difficulty thinking and concentrating.
Mhm.
The feeling of worthless, that for me ties into the shame, the guilt, the low self-esteem, all of that. Because when we start to talk to ourselves and we're like, oh yeah, well, I've been through this, and being going through this has caused me to feel this way about myself. And that's the main part. I think that's where, once we become aware of what it really is, we can understand it, and
Mhm.
we can go from there. What are you thinking?
Yeah, I mean, worthlessness is a big factor because it can lead to more intense symptoms of like suicidality, um, self-harm. So if there is just at a baseline a low sense of self-worth, then that definitely is concerning. And it's important to take a look at it and make sure that the person is screened and watched after and assessed, to make sure that it doesn't escalate into something more. Um, that's the biggest thing, that especially with the young population, that there's so much stigma in the world surrounding like mental health and especially depression, that you know kids basically kind of, not all kids, but a lot of kids kind of like deal with it on their own. And there are so many factors that are missed, and the kid doesn't speak up, and no one's doesn't really see those factors because the kid is hiding it. um, then it can escalate, and then you won't know until something happens, like the kid winds up in crisis, and then kind of like have to play catch up because um, you
and
know
or trying to commit suicide, because that's a big thing, because that's
yeah.
that's where, once we recognize the depression, that's what we're trying to do, keep them from actually getting to that point
Mhm.
of it turning around and being suicide. So we look at a lot of different things, and then we find that who depression is affecting. And it shouldn't get to the point where, as though something happens in order for us to find out that it's actually affecting not just children, not just adults, men and women. It's affecting anyone and
Mhm.
everyone. So that's the main role. It's just like, sometimes these factors are tied into why these children and adults are being depressed. You have bullies, you have adults who are bullies, children who are bullies, and that's where it stems from. It's like, okay, and then that causes that depression. So now you have other kids who are being, who are depressed based off of what someone is doing to them. So that's a major outlook, but at the same time, it's like, that's a whole nother beast to tackle. you know
Mhm.
yeah, so a whole nother beast. And but I definitely, as far as the like the effects, like who it normally affects, that's what I'm looking into. Like, it can affect anyone. We know depression can affect anyone. um but the major thing is who it's affecting. Like, is it affecting a more population than it is another population?
um, I mean, right now with the pandemic going on, studies are coming out that it's affecting the younger kids more so than it has in the past. Even in just where I work, we're getting more and more referrals for our younger, kids, and then we're also having young adults that
Okay.
are being affected by it. So I think, across the board, like you said, it can affect anybody, but I think the younger um, population is being affected more so. And then the older population, I think, is also being affected because, you know, they're, as they get older, they become more isolated, their functionality is impacted due to various health reasons or other types of limitations. So that's what we're always trained to watch for the younger kids and our geriatric clients. When they start showing risk factors, then it's important to kind of step in and start, assessing and doing what we have to do.
Okay. So I know the factors can play a role. The several different factors can play a role in depression as well, like the biochemistry, the genetic factors. It can be passed down because someone else in your family has suffered from depression. It also, one factor that is not really addressed, your eating habits.
Mm-hmm.
Your eating habits can become a factor of your depression as well. So say like if you're not a person that basically takes care of your body, and most of your diet is probably bread and sugar and things of that nature. That sugar, because sugar can also mess with your brain.
Mm-hmm.
So but that's not a factor that we always address, because a lot of the factors are addressed just directly. It's like the personality disorders and things of that nature, and but it's a lot of other factors that is that considered environmental? Is that an environmental factor? Because I know an environmental one is probably the one that's like where you're at, those type of factors, but
it could be
poverty,
in, like the wide umbrella of it. It's just proper dietary concerns that need to be addressed. So it could be in the wide umbrella of environmental factors.
Environmental factors. That's what I was thinking. I just know that there's a lot of things that we probably don't even say or talk about that can actually cause depression as well. Because we're always like so focused on maybe some of these factors. We just try to pinpoint, okay, why, when, and where, did this all take place? So yeah, but I know personality, the low self-esteem one, shame, guilt, easily overwhelmed by stress, things that might overwhelm them, those stress factors, like something simple to us could overwhelm them very quickly and easily. So we might be able to do something in like 2 seconds, and they'll, just by looking at it, and they could get overwhelmed by that type of stress and stuff of that nature. So basically, we went into the what factor, like what causes depression. Is that the factor we should go into? What causes it?
Yeah, we can do that.
Okay, so what's causing the depression? Because we did talk about it. We said the factors. That's basically what it was, the factors. The biochemistry, genetic, personality, and environmental factors is what's causing it. And basically what we have to do is boil down to which factor is, because at the end of the day, they all of those factors are going to have to be helped. It's just which factors are the most effective in, which ones can we be most effective in. Environmental factors we can be very effective in, because if you come from, sometimes poverty plays a major role, and families get so overwhelmed with finances, they get overwhelmed with things of that nature. So some of those factors I think can possibly be addressed. I think environmental ones might be the easiest ones to be addressed, because
yeah, I mean, environmental can definitely be addressed, where it's like if somebody is struggling with poverty, they can get linked with an agency to help with paying bills, or helping finding housing. So that's possible. If they're in a dangerous, say it's a child, for example, and they're in a dangerous situation, DCP&P can get involved and potentially remove the child, and then that opens up another can of worms associated with foster care. But at least an imminent danger can be removed. And then if there's some sort of family dynamic that's happening, then if the family were to come into therapy, for example, then that can be discussed and communication can be opened and see what we can do to help with that. So environmental can definitely be addressed. Psychological factors, if they were to come into therapy, can be addressed.
Yeah.
Same with, if they were to come into therapy and they were to see an APN or a psychiatrist, they could get medicine to help with the chemical imbalance that were to be in the brain that contributes to depression. So, all of these factors can be addressed. The efficacy of them depends, especially with, like, say, medication. There's all kinds of medication that can be used. So you'd have to find the right fit and see if your body is tolerant to certain medications. And then with finding the right type of therapist to do what you're looking to do.
Yeah.
So
I think what they're addressed, because you just like you're saying, like, it's not a one size fit all for everyone. So basically, even if certain factors need to be addressed, even if it's not dealing with this in per se, certain factors just need to be addressed so that they can basically be handled. So that, say, like, the reason why a child was depressed was because they're being bullied. That could be addressed. But that's, like you said, it's not a one size fit all. It doesn't, everyone doesn't need medication because they're depressed. Just like everyone doesn't need to be schooled on bullying, because that might not be what their depression is. Right. So yes, those are the things that I think we get most to the bottom of, because we can't look at it from a one size fit all. We have to look at it from individual. Okay, individually, what is it that you're going through? When did this all start? And that's another factor as well, the when factor. When did it start to inspire? That's a major thing, because it could have been going on for a very long time, and a lot of families just aren't able to recognize it. When families start to see, even with their children, when families start to see that their children are wanting to be by themselves, wanting to be isolated from other people, don't really want to do things with the family per se, and that's also for an adult as well. So I think when we start to recognize what depression actually looks like, then we can start to say, okay, you know what? I'm starting to see signs. Because I think that's the problem, when we don't recognize the signs, is where we get caught up and start to look at it from a standpoint of, I never knew. We need to recognize the signs. Isolation, that's a big one. Loss of appetite, we just talked about that. Change in behavior, that's another one. I think the pandemic has caused a lot of different changes in behavior, and probably our children's and our adults, because when you're accustomed to doing something and then all of a sudden it's just like wiped away, that can cause you to feel some type of way, and in some way, shape, or form, you're like, wait a minute, I've been doing this so very long, and then the uncertainty of so many different things. Now how are you supposed to look at it? So I think that's the when part. When is it starting? And then we can recognize, okay, why is this going on? Why is this happening? Why are you feeling the way that you feel? Okay, now we see why, because this is what had transpired, whether it be a child that's being bullied, whether it be a child that's going through abuse, whether it be a child that's been dealing with sexual abuse, whether it be a child that's been dealing with emotional abuse, or neglect, rejection. These are so many different things that play a major role in how a child and an adult can see themselves and want to hurt themselves. So I think trying to push them towards trying to get out of that mindset is the greater need, you know. And some people, yes, some people it just doesn't, it's not, like I said, it's not a one size fit all, so it doesn't work. And that strategy doesn't work for them, but
Mhm.
another one might work. Prayer, you know, other things, and some maybe some things like you said, the medication, maybe some people may need it. So it's a lot of different things and a lot of different factors, but as long as we're addressing the who, the what, the when, and the why, then we can basically, we can talk about it. We can basically get to the bottom of all of it. So I'm trying to think. I had a scenario for you, and I was just going to read it, and you basically just tell me which depression the man was experiencing.
Mhm. Okay.
Like a little game. Hold on. Okay, so I have wrote like a little scenario, and it's about this man named Jason who worked for an airline company for 25 years. He's a devoted worker, very easy to work with, never missed a day at work. Jason recently married his long-term girlfriend for of 11 years and experienced their first child. In those years, Jason was promoted to several positions. He was first baggage claim, TSA inspector, last he's a tower manager. And the job paid Jason enough to get his home, a 5-bedroom home for $375,000. Jason wanted to make sure his family was provided for, so he told his wife when their child came, she could stay home and raise the child. She was okay with the arrangement for a year. Then she would head back to work. Jason started experiencing some pressure at work to meet the requirements of tower manager that he has been in 7 years, but manages well enough to keep the position and makes minimal mistakes. Jason started feeling more pressure because his child will require him to spend time away from work. So Jason and Tia had a discussion that they would take off at least 1 month to bond with their child, and Jason agreed. Jason put in time in that work because he believes his wife would deliver earlier than expected. The airline was not in agreement with this, and the director told him it would be very hard to fill his position, but they would have to make adjustments when necessary. The new baby arrived, right time. He was able to bond with their new daughter, but he was eager to get back to work. When Jason returned to work, he realized that his position was downgraded along with his pay. He spoke to his director and wanted to know what was the problem. His director said that because his position required 4-day, 12-hour shifts, he has they saw in his best interest to pull him and put him in a different position. The director felt he needed more time, but he could get the lesser pay for the position. So he had to take that position, but it was very stressful, and to maintain his bills. He wasn't sleeping good, not talking much, and became very agitated, even started calling out for work. So what type of depression is he experiencing?
I think initially I would start him with moderate depression, because he's isolating, not sleeping well, calling out of work. That is showing, he used to enjoy work, so showing the loss of interest and probably motivation, engagement issues. If it continues where, it were to continue for a certain length of time and he were to show more symptoms, I wouldn't be surprised if he moved into major depressive disorder. If there were some, factors that intervened, because, his whole life, it sounds like, was built on this career, and it is abruptly being changed because of a new, because of his daughter. So, that can be devastating for somebody. So that could definitely lead him into a more intense and severe depressive state.
So the next question is, so that's also a question that's for us. What can Jason do to lessen his stress that is onsetting his depression?
I mean, there's a number of factors that he can do. Right off the bat, he can just set boundaries. It sounds like such a simple thing, but setting boundaries with his work and being like, this is when I'm going to be able to come in, this is when I'm not going to be able to come in. It could put him in jeopardy with his job, but he has to put his mental health first. So that's something that he can do. There's a various amounts of coping skills that he can do that when he starts feeling overwhelmed when thinking about the job, he can engage in. There's things that he can do that if he has negative thoughts surrounding the job, surrounding his self-worth, any shame or guilt he might have about, being away and now he's demoted, he can challenge those. Some cognitive therapy is probably going to be helpful to help rearrange his thoughts and his thinking patterns so that they're not so negative. That's just right off the bat, some things that he might be able to try.
I was just, because I think that's even with even the whole situation, even sometimes with depression, it's changing the negative thought. It's changing how you actually see yourself. It's changing how you see the whole entire perspective. We may go out here and we may see something and something may happen. We might even get in a car accident or something like that. And your whole entire day is ruined. But the reality is that your whole day doesn't have to be ruined. Mistakes happen, accidents happen, things happen, and this is life. We're never not going to be, things are never going to not be able to be expected to happen because some things don't go the way that we want them to go. So, that's another thing, but I definitely agree with you. I agree with you as far as like the negative self-talk, and he can basically the cognitive part. He can even get counseling. He can even he can even talk to his wife, because the scenario just broke down just a little bit of things, but it didn't really break down a whole lot because we don't know the other factors. Like, is he holding a conversation with his wife? Is he talking to her, telling her how he feels about even the job? And I definitely agree with you about the boundaries. You definitely need to set boundaries, and what comes, and that's what a lot of people don't understand. A lot of us don't understand as well. Mental health is the most important thing, because if you're not mentally and emotionally right, then you can't go to a job, you can't work, you can't do what you need to do for them, you can't do what you need to do for your family, you can't do what you need to do for your husband, your wife, your significant other, whatever the situation may be. So even your children. So I think because the mental and emotional needs to be addressed on a regular basis, that's where, those boundaries come in and say, okay, this is what's important, even if it costs me something, right? I think so. Go ahead.
Mm-hmm. Yeah, I mean, I think it's definitely important that people put their mental health, first, because, if you're not good, you're not going to be able to be good for other people. They always, like in our business, they have saying you can't pour from an empty cup. So, if you want to be able to do your best and, do what you have to do throughout the day, you want to be able to have something in the reserve so that you can help other people and perform your job and take care of your family, just take care of the day-to-day things that you have to take care of.
Yeah.
So
absolutely, I agree, and I enjoyed this session too.
Yeah.
We just giving them some information, getting to the bottom of bottomless conversations.
Mm-hmm.
Because they are bottomless. But I definitely enjoyed basically us just breaking down the factors of depression, breaking down, some of the, some of the roles, some of the things, some of the changes that we need to look forward to. And this should be able to help others, so that they'll be able to help not just their own family and themselves, and as far as like you were saying, setting the boundaries and stuff of that nature and doing what you need to do to take care of your mental health, because that's the most important thing. Your mental health is more important than even your physical, because if you're mentally not right, guess what? You're not going to want to go up and go run. You're not going to walk. You're not going to want to talk. You're not going to do anything. So yes, so that mental and emotional health is the most important thing. And I thank you, Beck, for coming on. I thank you for assisting with today's outlook on depression, for Same Face, Different Emotion. Like I said, we're here to make people aware. We want them to understand. We want to be able to listen to them and they listen to us. We want to be able to learn, as well as teach them and relate to those situations, as well as, they'll be able to go out and educate somebody else, and or we educate them. So, that's this is cycle. I find it to be a positive one if, if we work, work it out the best way that we know how to. But educating, teaching, and building healthy families and generating, healthy families through communication is what we're all about. So thank you. You've been a blessing, and it was cool you being on. So I'm just going
Thanks for having me.
no problem. And I will talk to you in a bit.
Okay.
I'm just stopping